You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emron. On today's episode, I actually want to talk about an episode of TED Talks that I saw recently. I'll give you a brief synopsis, and then we'll jump into the topic of discussion. The person who gave the talk, her name is Kira Kowalski. That's spelled Cherakowalski. Kira Kowalski. She's actually a librarian in Philadelphia, and she talked about her experience as a librarian in her city in an area that is very underserved and has a large amount of endemic crime, health issues, and poverty. Now, as a librarian, she was responsible for managing the books and the day-to-day activities inside the library, but she talked about how outside the library was a park. And in that public park, there were dozens and even hundreds of people who would come and buy drugs and then inject heroin and other substances in broad daylight. So these would be people who came either from out of state or from other areas throughout the city to purchase drugs, use them on site, and then some of them would actually pass out. People began dying in front of the library in the park where children and teachers and school groups would come to use the facilities of the library. So her talk was really about what she saw on a day-to-day basis. However, the interesting thing is that one day there was a person who overdosed on heroin on the front steps of the library, and Kira called 911. She administered the emergency response, and then she took out a dose of Narcan, administered it to the individual who had overdosed, and the person who overdosed woke up, got up, and walked away. And that's what we're going to talk about today. What is Narcan? And what is the role of librarians and public health people, as well as people in general, lay people, in the role of the opioid epidemic that we are faced with today? Now, Kira talked about her own struggles with drug abuse in her family, in her personal life, and so she was well aware of the personality and the challenges that people have in managing some of these very, very serious conditions. She took that as an opportunity to really change her life around, and that was one of the reasons why she wanted to be a librarian in the inner city and provide care for the people that she had grown up with. She took an active role, and she was one of the first people who participated in the initiative called Train the Trainer. So the Train the Trainer is a program where people can actually learn how to administer Narcan in a situation where people may die. And this can be life-saving because, for example, if someone has overdosed on heroin or even other prescription medications and they can't breathe, they're not acting right, they're harm to themselves, you call an ambulance, it may take 10 minutes or 15 minutes or even longer for an ambulance to actually arrive and be able to administer care to that person who's basically passed out, not breathing, and in a very, very serious situation. So with the Train the Trainer initiative, regular people are taught how to administer Narcan. So Narcan is actually called naloxone. That is the chemical name of it. Narcan is the brand name. It comes as an injection, which can be given either IV. It can also be given IM, meaning it's a shot in the muscle, or it can come in a nasal form, which means you simply spray it up the nose. Narcan was actually developed in 1961, so it has a very, very long track record, and there are almost no side effects known with Narcan. What happens with opioid abuse, which includes heroin, Vicodin, Percocet, morphine, fentanyl, all of these are related to one another. They all have a similar chemical structure, and they bind to receptors that are in the brain and other parts of the body. So the opioid receptors get saturated when you overdose on Percocet, Vicodin, codeine, heroin, any of those substances. Some of those are prescribed medications, meaning if you have surgery, your surgeon may prescribe you painkillers. Some people may have a horrible car accident, they break a bone, they need painkillers. Other people may have a baby and they need pain medication. And the heroin, of course, has been illegal since it was first introduced and outlawed in the United States and other countries, but people continue to obtain it. Now we are seeing cases where people are mixing heroin with fentanyl, with other opioids, and that's why we have an opioid epidemic in the United States. So Narcan is now being revived as a life-saving medication because if someone does overdose on an opioid, either by accident or on purpose, the Narcan can be administered. And within 5 to 10 minutes, it will begin to work immediately. It bumps out the opioids from those receptors, allows that person to breathe again, to basically wake up again. And as in the case that the librarian discussed, the person just walked away. And that's really the idea, is that if we can keep people out of the hospitals, keep people out of the emergency rooms, keep people from dying from this opioid epidemic, it might make a huge difference long term. And so now there are many, many states across the country that allow people to purchase the naloxone or the Narcan without a prescription. And CVS has a list of pharmacies that will allow that, which I will include on our show notes and blogs as well. Now, there are many famous people or celebrities who have actually overdosed and required doses of Narcan. So recently there was a singer. She's about 25 years old. Her name is Demi Lovato. She's very well known from Disney Channel movies. She's a well-known singer, multimillionaire. She recently overdosed in her own home, and the stories may be conflicting as to what she did, how she did, and why she did it. But basically, she was given Narcan at her home before she was transported to the emergency department and before she was admitted for basically opioid abuse. Now, we don't know if it was heroin. We don't know if it was fentanyl. We don't know if it was Percocet, Vicodin, codeine, or any other medication. But as I mentioned earlier, it doesn't matter. The Narcan works, and there are basically no side effects with it. So now 911, EMT, paramedics, all these personnel are instructed to give a dose of Narcan. If there's any possibility of an opioid overdose, give it in the home. And then when you transfer the patient, if they wake up and they suddenly improve, that means you're on the right track. If it doesn't make a difference, meaning you gave the medication, they haven't responded, again, it's not going to cause any harm. So it is recommended to go ahead and continue administering it. Now, in terms of the Train the Trainer initiative that I alluded to, I will also recommend that people increase their awareness of the training that's available. And if a librarian can do it, then that means that many other people in different office settings, in the home, as well as out in the community, can also learn it very easily. Think of it as another form of CPR. So CPR would be chest compressions and giving rescue breaths. Narcan is a rescue medication. So it's something to really, really consider. And if you don't have a program in place in your city, whether you live in a big city, whether you live in a small town, it doesn't matter. The opioid epidemic is very, very bad. And right now, every day, currently the statistics say that every 16 seconds a person dies from an opioid overdose, whether it's a prescribed medication or an illegal substance. And so in our lifetime, we will see a large increase in this problem. And the only way to combat it is with these types of medications, along with education, training, and community support. So again, her name was Kara Kowalski. She's on TED Talks Health. I will have a link to her speech, which was a wonderful presentation of her experience. And I really felt that there was a lot of information in there, medically as well as non-medically speaking, that all of my listeners would benefit from. Now, if you know of anyone who suffers from opioid dependence, any kind of alcohol or drug abuse, or someone who may benefit just from knowing about this information, I do have a large number of resources that I'm going to update on the show notes and blog as well. Please send us your feedback. Let us know of any questions you have. If there's ideas or thoughts on ways that I could improve and provide even more awareness, please connect with me on social media, and I'll be sure that we spread the news about that. So again, thank you so much for joining me on this week's episode. I look forward to having you back again next time.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.